Hello, I'm Ann Geffen, Executive Director of the TANGO2 Research Foundation, and welcome to this episode entitled Igniting Hope Through Research. Today, I will be talking with Dr. Sam Mackenzie. Dr. Mackenzie is a physician scientist at the University of Rochester Medical Center, where he treats patients with genetic neuromuscular diseases and oversees a lab with people who have dedicated their lives looking at microscopic worms. Dr. Mackenzie is the chair of the TANGO2 Research Foundation Scientific Advisory Board and is a key opinion leader for the TANGO2 community. Thanks for joining me today, Dr. Mackenzie.
Thank you for having me, Anne. And I will say they haven't dedicated their lives to looking at microscopic worms, just, a few years of their life. So,
That sounds good. Well, we appreciate it. And by the way, happy Rare Disease Day.
yes, you too.
So let's dive right in. Please tell us, and to our listeners, how did you first get involved with the TANGO2 Research Foundation?
So I think, like a lot of clinicians that are part of our group, I had a few patients myself who were diagnosed with TANGO2. And at the time, we didn't know as much about the disease. We didn't know as much about the protein and kind of seeking answers. I think that's what brought me to the foundation. I remember meeting you, I think in 2018 or 2019, and a few others in the group at that time. And it's been really fun to kind of cultivate those relationships and bring on new people.
Yeah, I do remember that first email that popped in. I'll never forget it because I was very excited. I knew that there was potential for collaboration and growth right there. So, thank you for reaching out to us, and we're glad that you're part of the community. Can you tell us what research is being done with actual patients to improve the standard of care at the moment?
Yeah, so lots of research beyond, worms and fish and flies and all the other models that we have for this disease. In actual human patients, we're doing a lot of work. So most of that's been led by the group at Baylor, and namely Sima Lalani and Christina Miyake. So they've really spearheaded the retrospective natural history study, which has provided a lot of kind of aggregate data that lets us do some pattern recognition in this condition and see what really stands out. And we're hoping to kind of convert that into a prospective study where we actually can follow patients with TANGO2 into the future and see, if some of the signals that we see, for example, the effect of B vitamins, if that really holds up versus if it's more something that's just prone to sort of recall bias, right? So beyond, or I guess within the natural history study, we're also looking closely at some of the specific symptoms like movement disorders. And that's something that we're kind of spearheading here at Rochester. Few of my collaborators are pediatric movement specialists that have taken the time to go through lots of videos. And then we talk to families about what might have been going on at the time that their child was, had a head tilt or was less responsive or had kind of wobbly walking. So the movement piece is a really interesting study, and I think important for improving diagnosis at younger ages before those kids present in metabolic crisis. And, apologies for the long answer, but we're also working with the 22q population and trying to figure out which symptoms of TANGO2 we can use as screening symptoms to diagnose kids in that cohort or in that population.
Right.
So lots of things going on, and we're hopeful to kind of launch some clinical trials in the next few years as well.
That's amazing. You mentioned big B vitamins. So I would definitely say that's one of the biggest change that we've seen in the fight against TANGO2 since you've been involved. Can you kind of expand and tell us a little bit about that?
Yeah, so this kind of came out of two areas. So one was the natural history study. I think Dr. Miyake and others in that group had sort of seen the signal where kids on vitamin supplementation seemed to do better. And it wasn't clear which vitamins were helpful, but looking back, those that were on B vitamins, B complex vitamins that included B5 and B9, seem to have almost a complete reduction in the risk, full reduction in their risk of having a metabolic crisis. So that was really powerful.
So, Dr. Mackenzie, what research is being done with actual patients to improve the standard of care?
So I think there's really more than we have time to talk about, Anne, which is a good thing. So beyond, what we do in the lab with worms or flies or cells, there's a lot actually happening with patients who have TANGO2. So the biggest one historically has been the retrospective natural history study, which is largely conducted through Baylor. And that's given us a ton of insights in terms of standard of care. Most importantly, the effect of B vitamins on the reduction of metabolic crises in these kids. So we're doing a part of that study here at Rochester where we're looking at movement disorders in children with TANGO2. And the goal there is to really put labels on some of these abnormal movements that kids exhibit so we can do a better job as a community of diagnosing this condition earlier, hopefully before kids end up in the ICU with a metabolic crisis. One other project I'd like to highlight, in the 22q community, there's a much higher risk of having TANGO2 since those patients are already missing one of their copies of the TANGO2 gene. And so we've done a lot of work looking at large cohorts of children with velocardiofacial syndrome or 22q deletion and trying to find what are those symptoms of TANGO2 that we can really latch onto and look for in that population to, again, get an earlier diagnosis of TANGO2 and then hopefully change the course of those kids' lives.
Right, right. And what changes have you seen in the fight against TANGO2 since you've been involved?
Well, like we talked about, the big one has been the B vitamin story, which is just so rewarding to have a win like that this early in the stages of research, right? So that kind of came out of the natural history study, but also some work done by the Sasher lab at Concordia University, where they had a Drosophila model of TANGO2 that was almost completely restored to normal on multiple different measures after exposure to vitamin B5. So that's made us really excited and kind of informed a little bit about where our lab has gone in terms of exploring different mechanisms for what that TANGO2 protein might be doing in the cell.
Right, right. So I'd like to kind of switch gears and I want to hear a little bit more of the work that you do and the work that you do with our patients, as a lot of our listeners are going to be the patients that have been touched by disease. So can you tell us some of the inspiring people that you've worked with since the beginning of your work on TANGO2 deficiency disorder?
Yeah, so I think, it's really a community, which has been a fun part of this whole journey, right? We've had since, in the 4 or 5 years that I've been involved with TANGO2 research, it's sort of the same crew of people who have really dedicated their lives to helping families, helping further this research. And then we brought on some people along the way and really haven't lost anybody. I think everybody has this kind of shared goal of figuring out, on the one hand, from a very academic perspective, what is happening, mechanistically with this protein in the cell, which is interesting in its own right. And then you have the completely, separate humanistic element of this. These are real people with a real condition that we can hopefully treat if we do our jobs right. So I think, honestly, it's hard to single out one person, but that whole research community has just been just great to have, for the highs and the lows as we've kind of moved forward. And then, I'll say the patient community themselves is really inspiring to me. The families and the fact that they're dealing with, in some cases, pretty impaired children on a day-to-day basis and everything that goes with that, working with schools and mobility. But they're still showing up and still fundraising year after year so we can do this work. So that's a big source of inspiration as well.
Yeah, that's wonderful. And what drives you to continue to work toward treatment and therapies? It sounds like the families are a big part of it, but anything else?
Yeah, so I mean, again, going back to that academic side, I've said this from the get-go. I think one of the fascinations for me is just the puzzle, right? Of what is this protein doing, and thinking creatively about tools that we can use to figure that out. So that to me is a big drive. And I get picked on by my graduate student that I'll send emails at 1 a.m. because I'll wake up and I'll think about some, new experiment that we ought to try, but it's kind of always there in my brain, kind of in my subconscious. I'm thinking about TANGO2 from different angles. So that's been kind of fun. Maybe a little bit crazy, but fun.
Well, it sounds like you're very self-driven, self-motivated, but it's a huge task, right? Trying to find a cure. Do you ever find yourself lacking conviction? And if so, how do you manage that? How do you get yourself excited and motivated again?
Yeah, so I think my approach to this is it's a really hard problem. It takes a team, and not everything that we do is going to be a success. And you start with that reality. And I think once you are comfortable with that sort of as a framework, you do your best, and you can be satisfied with your best. So that's been my approach to a lot of what I do in my job. Outside of TANGO2, I take care of a lot of conditions which are pretty tough for patients and for families.
Yeah.
And so if you can do your best and give it your best shot, and do what you can for these patients, I think it makes it a little bit easier to find that satisfaction.
Right. And how do you cope with delivering difficult news, or how do you mentally prepare yourself to deliver difficult news when you're interacting with these patients?
So difficult news is difficult, right? Which is why they call it that. And I don't think there's a single answer. For me, my approach is always to be as honest as I can. And I'll frame that discussion at the outset and say, I have difficult news. That sort of allows, the receiver to brace themselves and sort of prepare. And then once you get into the conversation, I think it's about being honest and letting them know that you will tell them everything that they want to know. And that establishes that trust. And I think a lot of times, there's a tendency for us to just dump information, right? We kind of retreat to this academic defense mechanism where we intellectualize everything. So I think when you're giving that news, it's important to pause, allow the person to reflect, ask questions, and say, if this is too much right now, we can continue this conversation later. So those are some of the techniques I've used and I found to be pretty helpful.
Yeah, that's great. That's perfect. And do you ever build relationships with families outside of the exam room?
Yes, absolutely. So that's, I think, the best part of my job is working on those relationships from a advocacy standpoint, from a research standpoint. So I have a lot of families that are very motivated, whether it's TANGO2 or something else, to advance the standard of care for their kid, because it's frankly not sufficient where we're at. So I think for me, it's the same thing that I like about research. It's not so much the process of doing research, but it's the process of advancing that standard of care so we can do, better for these patients in the future.
Right, right. And speaking of future, if you had a crystal ball, what do you think you'll see coming from the research that's being done on TANGO2?
Yeah, so complete guess, and this might be optimistic, but I think it's realistic. I'm hoping that we are in clinical trials for at least one, maybe multiple compounds that might be full cures for TANGO2. I think we'll have a better understanding of the B vitamin process, and I'm saying this in the next 5 years or so. What B vitamins are doing, which will then inform what other treatments we might be able to add to them. So I think we'll be close to a full cure, I would say, in the next decade. And that's, again, maybe optimistic, but I think a real possibility.
Yeah.
At that point, hopefully we've got TANGO2 on the newborn screen so we can identify patients again, before they even have those symptoms. And then we have to be thinking globally too, because not every country has newborn screening. So we have a lot of work to do in terms of that early diagnosis.
Well, Dr. Mackenzie, I want to extend my appreciation to you for joining me today. I know how busy you are, and your willingness to share your experience, your insight, your story. It really provides invaluable guidance to families and caregivers. And to our listeners, thank you for tuning in on Rare Resilience, where we journey through the world of rare diseases with compassion and understanding. Join us next time as we continue to explore the triumphs and challenges of caregiving in the face of adversity. Until then, remember, resilience knows no bounds, and together we are stronger. Stay tuned and stay resilient. Thank you.
Thanks, Anne.